Big Tobacco's global expansion, how PMI targets developing nations. While Western governments have spent decades battling big tobacco through lawsuits, regulations, and public health campaigns, Philip Morris International quietly executed one of the most cynical corporate strategies of the 21st century. In 2008, as smoking rates plummeted in wealthy nations and legal costs mounted, PMI spun off from its American parent company and set its sights on a different prize, the developing world. What followed was a 15-year campaign of aggressive marketing, regulatory capture, and systematic targeting of vulnerable populations, particularly children, in countries least equipped to resist. This is the story of how the world's largest international tobacco company transformed global health disparities into profit margins, leaving a trail of addiction, disease, and corporate malfeasance across 3 continents. The genesis of PMI's global expansion strategy began with a simple mathematical reality. Developed markets were becoming increasingly hostile to tobacco companies. By 2008, smoking rates in the United States had fallen to just 20.6% of adults, down from over 42% in 1965. The European Union had implemented comprehensive tobacco control policies, including graphic health warnings covering 65% of cigarette packages. Australia was preparing to become the first country to mandate plain packaging, stripping tobacco companies of their most powerful marketing tool. Meanwhile, legal settlements in the United States alone had cost the tobacco industry over $365 billion since the 1990s. Philip Morris International's solution was as obvious as it was morally bankrupt. If wealthy, educated populations with strong healthcare systems were rejecting cigarettes, the company would focus on poor, less educated populations with weak regulatory frameworks and limited access to medical care. The corporate restructuring that created PMI as an independent entity was a masterpiece of strategic planning. By separating its international operations from Philip Morris USA, the company insulated its global expansion from American litigation and regulatory oversight. PMI immediately controlled operations in over 180 countries and territories, with a portfolio led by Marlboro, the world's best-selling cigarette brand. The company's initial public offering raised $19.9 billion, providing enormous capital for its expansion plans. Within its first year as an independent company, PMI was already generating revenues of $63.4 billion, with 73% of those sales coming from markets outside the traditional Western sphere. The message was clear. PMI would be a different kind of tobacco company, one unencumbered by the legal and social constraints that had hampered the industry in developed nations. Indonesia became PMI's crown jewel and a template for expansion throughout the developing world. The country offered everything PMI sought: a massive population of 270 million people, minimal tobacco regulations, and cultural acceptance of smoking, including among children. By 2010, PMI had captured nearly 35% of Indonesia's cigarette market through its subsidiary PT HM Sampurna, which it had acquired for $18.4 billion in 2005. The results were staggering and horrifying in equal measure. Indonesia now has one of the world's highest smoking rates among men, at 67%, and the lowest average age of smoking initiation. Children as young as 5 years old can be found smoking cigarettes, a phenomenon that has earned international condemnation but continues largely unchecked. PMI's marketing strategy in Indonesia relied heavily on youth-oriented advertising, sponsorship of popular music events, and the distribution of free samples near schools. The company's internal documents, revealed through litigation discovery, showed executives celebrating Indonesia as a growth market, with limited regulatory constraints and high youth uptake potential. The African continent represented PMI's next major frontier, offering a combination of rapid population growth, urbanization, and weak tobacco control policies. The company established manufacturing facilities in Nigeria, which became its African headquarters, and systematically expanded across sub-Saharan Africa through joint ventures and local partnerships. In Nigeria alone, PMI's market share grew from virtually zero in 2008 to over 15% by 2020. The company's strategy across Africa mirrored its Indonesian playbook. Aggressive marketing campaigns featuring Western lifestyle imagery, sponsorship of sporting events and music festivals, and the strategic placement of cigarettes in small retail outlets frequented by young people. Internal PMI communications described African markets as representing decades of growth potential due to their young demographics and emerging middle-class aspirations. The human cost of this expansion has been devastating. The World Health Organization estimates that smoking-related deaths in Africa will increase by 600% by 2030, with much of this increase directly attributable to the marketing practices of international tobacco companies like PMI. Perhaps nowhere was PMI's targeting of children more systematic and brazen than in the Philippines, where the company launched what internal documents called Project Sunrise in 2012. This campaign specifically aimed to increase cigarette consumption among Filipino youth aged 15 to 24 through a combination of social media marketing, celebrity endorsements, and promotional events at universities and shopping malls popular with teenagers. PMI partnered with local distributors to ensure cigarettes were readily available in single-stick sales, a practice that makes cigarettes more affordable for children who cannot afford entire packs. The campaign included the development of flavored cigarettes designed to appeal to novice smokers, despite PMI's public statements supporting flavoring bans in developed markets. By 2018, the Philippines had the highest rate of smoking initiation among Southeast Asian countries, with 60% of Filipino smokers having started before age 18. When confronted with evidence of its youth marketing practices by Philippine health authorities, PMI's response was to increase its lobbying expenditures and file legal challenges against proposed tobacco control regulations. PMI's expansion strategy relied heavily on regulatory capture and political influence, tactics the company refined through experience in markets with weak governance structures. In Ukraine, PMI spent over $12 million between 2015 and 2020 on lobbying efforts designed to prevent the implementation of European Union-style tobacco regulations, despite Ukraine's aspirations for EU membership. The company established a network of local law firms, public relations agencies, and political consultants who worked to influence legislation at both national and regional levels. In Morocco, PMI executives met privately with government officials over 150 times between 2016 and 2019, according to internal company records obtained through Freedom of Information requests. These meetings preceded Morocco's decision to delay implementation of graphic health warnings and plain packaging requirements that had been scheduled for 2018. PMI's political influence operations extended to international forums as well. The company spent significant resources attempting to undermine the World Health Organization's Framework Convention on Tobacco Control, the world's first global health treaty, by funding ostensibly independent research organizations that question the effectiveness of tobacco control measures. The human cost of PMI's expansion became impossible to ignore as public health data from developing nations began reflecting increased smoking rates and smoking-related diseases. In Indonesia, lung cancer rates among men increased by 84% between 2010 and 2020, according to the country's Ministry of Health. The economic burden of smoking-related healthcare costs in Indonesia now exceeds $7.2 billion annually, more than the country spends on primary education. Similar patterns emerged across PMI's target markets in Africa and Southeast Asia, where healthcare systems already strained by poverty and limited resources found themselves overwhelmed by preventable smoking-related diseases. The World Bank estimated that PMI's marketing practices in developing nations would ultimately result in over 2.3 million premature deaths between 2010 and 2030, with the vast majority of victims coming from low- and middle-income countries. Despite these projections, PMI continued to expand its operations and marketing efforts, arguing that adult smokers in developing nations had the same right to choose tobacco products as consumers in wealthy countries. Legal challenges to PMI's practices began mounting in 2019 as human rights organizations and public health advocates developed new strategies for holding the company accountable in international forums. The case of Mauritius became a landmark when local health authorities successfully demonstrated that PMI had violated the country's consumer protection laws by marketing cigarettes as lifestyle products without adequate health warnings. The resulting $47 million judgment against PMI included a requirement that the company fund public health campaigns to counteract its previous marketing efforts. Similar cases emerged in Kenya, where PMI was found to have violated local advertising standards by promoting cigarettes during televised sporting events watched primarily by children, and in Guatemala, where the company faced allegations of tax evasion related to transfer pricing schemes designed to minimize its local tax burden while maximizing profits extracted from the country. These legal victories, while significant, represented only a fraction of the accountability advocates argued was necessary given the scope and impact of PMI's global operations. The COVID-19 pandemic exposed the full consequences of PMI's expansion strategy as smoking-related complications significantly increased mortality rates in countries where the company had successfully grown its market share. Indonesian hospitals reported that smokers were 2.4 times more likely to require intensive care treatment for COVID-19, overwhelming the country's already limited healthcare infrastructure. Similar patterns emerged across Africa and Southeast Asia, where decades of underfunded public health systems proved catastrophically inadequate when confronted with a respiratory pandemic exacerbated by high smoking rates. PMI's response to these developments was to launch new marketing campaigns promoting its reduced-risk products, including heated tobacco devices and e-cigarettes, while maintaining its traditional cigarette operations. The company's 2021 annual report celebrated record profits of $9.1 billion, with particularly strong growth in developing markets that accounted for 78% of its total cigarette volume. CEO Andre Calantzopoulos received compensation of $17.4 million that year, while publicly stating the company's commitment to reducing harm through product innovation. As of 2023, PMI continues to operate in over 180 markets worldwide, with its expansion in developing nations showing no signs of slowing despite mounting legal challenges and public health concerns. The company's Unsmoke campaign, launched with a $1 billion budget, represents its latest attempt to rehabilitate its corporate image while maintaining the cigarette operations that generate the vast majority of its profits. Internal documents obtained through recent litigation reveal that PMI plans to invest an additional $15 billion in emerging markets through 2030, with particular focus on South Asian countries including Bangladesh and Pakistan, where tobacco control regulations remain weak and populations are largely unaware of smoking's health risks. The ultimate success of efforts to hold PMI accountable for its practices in developing nations may well determine whether other multinational corporations can similarly exploit global inequalities in regulatory capacity and public health infrastructure. For now, Philip Morris International stands as perhaps the most successful example of how corporate globalization can transform public health disasters into private profit, leaving governments and communities to bear the long-term costs of decisions made in distant corporate boardrooms. The company's expansion into developing nations represents more than just aggressive marketing. It constitutes a systematic exploitation of global inequality that has condemned millions of people to addiction, disease, and premature death in pursuit of shareholder returns.